Ishihara chart. It is the gold standard rapid screening test for the color vision designed by Dr. Shinobu Ishihara. It is based on the principle of pseudo-isochromaticity. Individuals with color vision defects confuse certain spectral colors with another. Protanopes confuse red with green or grey or dark brown. Deuteranopes confuse green with red or grey or purple. Based on this fact, the plates of Ishihara charts are designed with a background of colored dots and a figure of a number or winding path made of different color in between. The dots are having different size and brightness but relatively isochromatic to the person with red-green color defects, so only called as pseudo-isochromatic plates. There are 38 plates of 6 different types, namely demonstration plate, transformation plate, vanishing plate, hidden digit plate, diagnostic or classification plate, and tracing or winding plate. The first plate is demonstration plate with a number of 12. As per the name, it is for demonstration of a test. It is visible to all the observers. If not visible, rule out very low vision or malingering. Second to ninth plates are called as transformation plates. Each plate here contains two different numbers superimposed on each other. For example, second plate, the normal one sees as 8, whereas red-green defect one sees as 3. Transformation of number is the hallmark of red-green deficiency. 10th to 17th plates are called as vanishing plates. Here, the hue of the figure blends with the background color for the color defective observer. So, only normal person can see the number. Color defect person sees nothing or random dots. 18th to 21st plates are called as hidden digit plates. Here, the number is visible only to the color defect person, as for normal person, it is invisible due to the dominant background noise colors. For example, this plate with nothing is visible as 5 for the red-green defect person. Till these are the screening plates. Now, 22nd to 25th plates are for diagnosis or for classification of color vision defects. Protanopes see only right-sided numbers or see them more clearly. Deuteranopes see only left-sided numbers or see them more clearly, whereas the normal ones see both the letters. For illiterates or young children or the patients with communication barriers, tracing or winding line plates are kept from the plate number 26 to 38. Similar to the numerical plates, specific lines are visible or invisible depending on the defect. Coming to the testing procedure. The test should be carried out under natural daylight. If artificial, then it should be simulating the daylight. Kindly note that the ordinary tungsten bulb should not be used as it gives highly inaccurate results due to the yellow bias. Testing distance should be 75 cm from the eyes. At this distance, the dots subtend a visual angle sufficient to stimulate the cones only. Without getting resolved by the rods, this distance eliminates the luminance cues given by the rods. The plane of the paper should be perpendicular to the line of the vision, and the test should be carried out monoocularly. Each plate should be read by 3 to 5 seconds only, because by prolonged staring, The patient may use other cues like saturation difference to guess the number. What about the use of spectacle? The patient should wear their spectacles but not the tinted ones or the colored contact lenses. How do we interpret the color vision? If the patient reads more than or equal to 17 plates out of 21 correctly, then it is suggestive of normal color vision. If less than or equal to 13, then it is suggestive of color vision deficiency. If it comes between 13 to 17, then it is borderline and we should repeat the test here. If the patient is color vision deficient, then see the results observed in the diagnostic plates. In that, strong protanope reads only right-sided numbers. Strong deuteranope reads only left-sided numbers, whereas mild ones may read both but one number appears significantly dull. Ishihara chart is indicated mainly for routine screening, occupational testing and optic nerve diseases. This Ishihara chart has got so many advantages. It is a highly sensitive, rapid, low cost and highly specific test for congenital red-green defect. Limitations are blue-yellow defect cannot be detected, severity cannot be graded as it is a qualitative test and is highly dependent on the lighting setup. To combat all these limitations, Hardy-Rand-Rittler plates can be used. Thank you for watching.